topic is on malnutrition in America compared to Haiti. You might ask, what is malnutrition? Malnutrition is when one does not get enough nutrients from the food they eat that are necessary for good health and an active lifestyle. While malnourishment, on the other hand, is not having enough food to eat to develop or function normally. Many people get these confused, but the main thing is that malnutrition is not getting enough proteins and nutrients that are necessary, while malnourishment is not getting enough food, and kind of like starvation. Haiti is ranked number 1 in the World Health Rankings for the highest death rate due to malnutrition in comparison to the entire world. The U.S. is ranked number 140. The death rate of Haiti is 53.3%, while the death rate in the U.S. is only 1%. That's such a huge gap difference. This gap difference tells us that Haiti has a much bigger problem than the U.S. And this is because it is more poor and a developing country and has many less resources than unlike the U.S. But both countries still face this issue of malnutrition. What are some causes of malnutrition in Haiti? Well, there's poverty and financial crisis, and the main problem in Haiti is that the land is not suited for agriculture, so they can't grow enough food, and it often leads to food shortages. And because food is such a shortage and such a necessity in Haiti, the prices go really high, there's inflation, and many Haitians are not able to afford this. And they live in poverty, so they don't get all the food they need and all the nutrients that are necessary in a healthy diet. Another problem is the lack of sanitation and hygiene, which often leads to diseases such as gastroenteritis, HIV, AIDS, diarrhea, and intestinal worm infections. These diseases often cause abnormal nutrient loss, which is bad for the body and leads to malnutrition, and even in some extreme cases, it can lead to death. 3/4 of Haitians live on less than $2 per day. I thought that to be really interesting. In the U.S., some causes of malnutrition are that there are isolated areas where there's no regular food supply, there's unhealthy food diets, there's extreme weight problems, anorexic problems, and these problems in your body often lead to eating disorders, which cause nutrient loss, and your body's not able to retain the nutrients which are necessary for functioning. There's the same thing as diseases, and there's poverty in some areas, even though people think that in the U.S. there isn't poverty, but in some rural areas, poverty does exist. And the lack of exercise and just having a balanced meal. Many people eat so unhealthy that it leads to malnutrition. And a fun fact is that 8.5% of Americans are hungry and experience starvation daily. Some effects of malnutrition are: it can affect a child's learning ability and performance in school. It can have a negative effect on mental brain development, growth, and physical disabilities. It can increase hyperactivity, anxiety, and aggression levels. It can lead to abnormal nutrient loss, as I talked about before, and chronic liver disease, celiac disease, and chronic illnesses. It can also lead to disorders in organ systems, such as senses of sight, taste, and smell. And just not having enough nutrients in your body and a good diet can always affect a body's ability to absorb proteins, nutrients, vitamins, and sugars. And it can eventually make a person so sick that death can occur. So you might ask, what are some actions taken in the U.S. to help solve the problem of malnutrition? Well, there are food banks and church-sponsored hot meal programs all throughout the U.S. And there's UNICEF and the FAO, food intake surveys weekly. Through these surveys, we see how many people don't have a daily food on their plate. Don't have food daily on their plate. And there's the food stamp program, which is also the supplemental nutrition assistance program. And basically what this does, it provides food assistance to about 1 in 3 children in America daily in Louisiana. There are many more of these programs throughout the states which are similar to this. The FSP helps ship canned food goods to areas with food shortages. We also have the Johns Hopkins Center, which collects donations for the hungry in the U.S. The U.S. also provides pre- and postnatal care, which is provided to undernourished women who give birth to low-weight babies. This is to help prevent malnutrition before someone is born. There's also new research, technologies, methods to solve or prevent malnutrition, such as vitamin tablets, surgeries, injections. There's also many government aid programs, such as the Department of Agriculture, which looks at each house's cash incomes to estimate its ability to buy food, and then based on those statistics, it will assist family households in getting the food that they need. Some actions taken in Haiti include UNICEF also and some more developing food banks. Food banks are not that common in Haiti, but they're starting to grow and spread out throughout the country. Church-sponsored programs such as missionaries also go and help Haitians in poverty and those who can't get one good meal a day. This is one of their big things when missionaries go and help in Haiti to give them food, see how their education is going, and many other necessary needs. They also provide hot pockets, soup, bread, potatoes. These are like hot soups, kitchens, stands, anywhere nearby where you can get food for help. They also have the International Child Care, which is also the ICC, and this detects developmental problems and then treats malnutrition. For example, they provide immunization for diseases. Haiti has received over $44 million in relief and aid programs from nations all around the world, including the UK, Canada, US, France, China, and Cuba, and many more other countries. They help create shelters and medical aid also for Haiti. The Relief Web pledged 8 projects to help with their financial situation through pledges and donations. They also have the sanitation relief programs and water supply care, which make sure that no water is diseased or has any bacteria in it, and sanitation is well taken care of. Action Against Hunger helps collect food and distributes it in shelters and offers new skills and knowledge about malnutrition so people know how important it is to have a good, healthy food intake. The Action Against Hunger also promotes the food pyramid and helps give people knowledge about good food diets. The Johns Hopkins Center, which is also in the U.S., and the World Food Program, the WFP, is government aided and it helps security for 1.4 million Haitians. The U.S. donated and provided financial support to Haiti during the earthquake and sent medical help and food supplies to help other people through their tough times. So basically the goal is to increase food security and implement programs to provide assistance to people who don't have the food that is necessary. And I believe that malnutrition is slowly gaining more importance and attention, and if everyone tries to put in a little effort to end hunger and famine in poorly developed countries such as Haiti, then malnutrition won't even be a problem anymore. And even though people don't realize that malnutrition is a problem in the U.S., it is. And lots of things are being done, and I'm sure that if we try harder, we can accomplish it.